Hey guys, it's Medical Minion with a new video on humerus bone. In this video, we'll discuss about the markings of humerus bone. So let's start our topic. As you all know, humerus is a bone present in the upper arm, or we call that brachium. And this humerus bone is a type of long bone that supports the upper arm and extends from the shoulder joint to the elbow joint. The first structure is a large round prominence that extends medially from the bone's proximal end, and it is called as head. It articulates with the glenoid fossa or glenoid cavity of scapula to form shoulder joint or glenohumeral joint, as it is between the glenoid cavity and humeral bone. So it is called as glenohumeral joint. Later you have another structure called greater tubercle, which is a large rough area located lateral to the head. Its posterior aspect bears three impressions that are upper, middle and lower, which provide attachment to supraspinatus, infraspinatus and teres minor muscle respectively. As you can see in the image, the attachment of this muscle to the greater tubercle. And to remember this, we have a mnemonic trick that is SIT, where S stands for supraspinatus, I stand for infraspinatus, and T stand for teres minor. Then you have another structure called lesser tubercle. Lesser tubercle is also a rough area located medial to the greater tubercle, and it serves as an insertion site for subscapularis muscle. So in the image you can see it has an insertion point for the subscapularis muscle, and now you can see a narrow depression or sulcus between this greater tubercle and lesser tubercle, which is known as intertubercular groove or sulcus. Now it is called as intertubercular because it is present between the two tubercles, and it is also known as bicipital groove. So the muscle that attaches here are the pectoris major that attaches to the lateral lip of the groove. You have teres major that attaches to the middle lip of the bicipital groove, and then you have latissimus dorsi that attaches to the floor of this intertubercle sulcus or bicipital groove. The image on the screen shows various muscle insertion on the lateral, medial and the floor of the bicipital or intertubercle groove or sulcus. To remember this, there is a mnemonic trick that is: lazy people might fail. Literally deal minimum technical matters for remembering the muscle insertion of the bicipital groove. The next structure we have to learn is the neck. There are two different necks. The first one is anatomical neck, which is a groove constriction between the head and the tubercle that serve as attachment point for the articular joint. The next structure is surgical neck, which is a region inferior tubercle as shown in the image. Here the bone narrows and fracture often occurs. The next region is shaft or body of humerus bone. As you can see, it's a cylinder shaped middle portion of the bone. You can see a raised rough area located on the lateral side of shaft at is nearly the midpoint is called as deltoid tuberosity. Deltoid tuberosity is a attachment point for the deltoid muscle. Coming on the distal side or the lower end of the humerus bone, you can see a round projection at the distal lateral end of the humerus, which is called as lateral epicondyle. The posterior surface of lateral epicondyle serve as attachment point for some of the muscles that extend the wrist and fingers of the hand. You can see a rough margin located above the epicondyle is called as lateral supracondylar ridge. It's on the lateral side and it's above the lateral epicondyle, so it's called as supracondylar ridge. The next structure is a round projection at the distromedial end of the humerus bone, which is called as medial epicondyle. This epicondyle is larger and more prominent than the lateral epicondyle. Some of the muscle that flex the forearm, wrist, finger attaches to the anterior surface of this marking. After this structure, you can see a rough ridge over the medial epicondyle, which is known as medial supracondylar ridge. Medial supracondylar ridge is called so because it is superior to the medial epicondyle and it is a rough area, so it is called as the ridge. Now, this structure provides attachment to muscles like brachialis and pronator teres. The next structure which can be visible on the distal end is the capitulum. It is a small knob-like prominence on the distolateral end of the humerus bone and it's called as capitulum. It articulates with the head of radius bone at the elbow joint. The next structure is a pulley shape located medial to the capitulum, which is called as trochlea. It's articulate with the trochleal notch of ulnar bone at the elbow joint. Then you can see a small depression located superior to the capitulum is the radial notch. This region provides space for the head of the radius when the forearm is flexed. And the another depression which is located superior to the anterior aspect of trochlea is called as coronoid fossa. This region provides space for the coronoid process of ulna when the forearm is flexed. So this was all about the anterior marking of the humerus bone. So now let's see what we have grabbed through this session. So the screen shows an image. You have to label and let me know the answers in the comment section, or you can visit my Instagram page and DM me the answers. So now we are going to study the posterior marking of the humerus bone. Meaning we are just gonna looking the humerus bone from the posterior view and identify the markings. So this is the image of the humerus bone on the screen. You can see structures that we have learned from the anterior view are also visible here, but new structure are also prominently visible. So what structures are visible to you? You can see head, you can see the anatomical neck, you can see the surgical neck, whereas only one tubercle is visible, that is the greater tubercle. Below you can see the shaft or the body of the humerus bone. You can also see the deltoid tuberosity. So you can see a new structure here, which is a shallow depression that runs diagonally along the lateral posterior surface of the bone next to the deltoid tuberosity, which is called as radial groove or sulcus. The radial groove or sulcus forms a partial passageway for the radial nerve and deep brachial artery. Coming down towards the distal end, you can see both the epicondyle, the supraepicondyle ridge. You can also see the pulley shaped structure trochlea, but a new structure or new depression is also visible above or superior to the trochlea, which is called as olecranon fossa. So you can see in the image, it is a prominent triangular shaped depression on the distal posterior surface superior to trochlea, and this area accepts the olecranon process of the ulnar bone when the forearm is extended. So here in the image, it's the posterior view of the humerus bone. You can label them and test your knowledge, what you have learned through this session. And do let me know the answers via comments or DMs on the Instagram. And do follow me on Instagram at @medicalminion. Link are in description. Thank you for watching.